Good morning once again, and thank you for waking up to Sunrise at Sea this Monday, the 14th of February, 2022. And yes, it is a Valentine's Day as well. Well, if you just joined us, you are right in time for Wellness with me, Sandra Cope. Now in studio, I have Dr. Moses Muliowa, and he's from St. Ruth's Medical Center. He is also the Executive Director of the Mukono District Private Health Care Sessions. And the topic of discussion this morning is atopic eczema. Good morning, doctor. How are you?
Morning, Sandra.
It's good to have you in studio this morning.
And nice meeting you also here in studio.
Well, let's dive right into it. Eczema. What is atopic eczema? Because I know there are many kinds, but this particular one, what is it? How does it manifest?
Atopic eczema, which we commonly refer to as atopic dermatitis, is an itchy inflammation of the skin. Atopic eczema usually develops in early childhood and more common in people who have a family history. So it may present like a scaly patching on the skin. Mm-hmm. And in most cases favors parts like the inner wrist. Okay. We have the elbows, then the neck, and also the knee. Okay.
Yeah. So it's hereditary. Yeah. It can be carried on in a family.
In the family.
What are the causes?
The cause may not be known even to the doctor. Mm-hmm. But it's a combination of both genetics, mm-hmm. immune system activation. So in this, we look at environmental triggers, mm-hmm. which someone gets exposed to something.
Like? Is it hot weather conditions? Can it accelerate it? Because if it's itchy?
It's itchy, and in most cases, when you're exposed to such conditions, it actually accelerates it more. So you look at it in a way that some are even affiliated with stress.
Oh.
Yeah. So in most cases, it's the immune system tends to overreact.
Yes.
On some of the irritants that have been identified or allergens. So these eventually trigger inflammation of the skin.
I see. Yeah. I get that because my son, he's 2, he has eczema, and like we would use different creams, but when it gets like hot, especially at night, you have like to remove, because he starts itching, it like triggers and it really turns color and the skin peels.
Actually, in most cases, we advise most parents to ensure that before getting to bed, like for your child, they must ensure that there's a warm bath, which mm-hmm. is given to the child. Then we have also moisturizers, which are advised in this way to enable the body avoid such irritants. And in most cases, many instances, we use petroleum jelly.
Petroleum jelly can work?
Yeah, which is non-perfumed.
Non-perfumed.
Yeah, without dyes. So in most cases, those elements are the ones they tend to react to, inducing that irritation.
And what other drugs can, like ointments, can parents get for this? Do they need to take over-the-counter ointments, or should they go and see a skin specialist?
Our advice as health professions, we look at a situation whereby parents should not be advised to just take over the counter. You need to see at least a professional health worker to be able to diagnose the condition better and gives you the appropriate treatment. But on a wide scope, we have a series of medications which can be used to manage this situation. We have antihistamines.
Stop the irritation.
Yeah, to stop the irritation. We have topical steroid-based topical applications. Then we also have topical antiseptics, which can be used in this situation.
If it becomes worse,
yes,
into wounds and stuff. So in what kids, babies, does it usually come up? Because I know little babies can have it, but can adults also have it?
Yes, it is common in the infants, but also it also goes, because this is like some of them are genetic affiliated, so you may find it is running in families. So we are always getting them in also big, and the adults, and also the young children. And in most cases, you find like for the adults, it will appear like those patchings with irritations, scaly patches.
With irritation.
Yeah.
And so what other kinds of eczema are there? Like how can you tell this is the atopic eczema?
Well, when you look at the signs, you're able to, in most cases, this may not be easy for a common person. That's why I've actually referred, like we need to seek medical attention from a professional person who can be able to, but we have them in several categories. Like actually most of them are like 7 categories. So depending on the site, where it has attacked. So you find some are in the scalp, the others are in different parts of the skin. So we categorize them accordingly.
Okay. Yeah. And what kind of diets? Should some people avoid some kinds of foods that can accelerate the condition?
Yeah, actually food you look at it in one perspective, that some people react to different types of foods.
Absolutely.
Yeah, so in most cases, the reason why actually we say the cause may not be known even to us, the doctors, but in most cases when you identify that you react on a certain food, we advise you to avoid it in a way that this may not induce a reaction within your immune system, because just that spark of the immune reaction will lead to inflammation of that particular part of the skin which has been exposed.
I see. So what would you advise parents? What would you advise parents out there with children who have this eczema? What should they do? Where should they take them?
I think I would advise parents to seek medical attention in specialists. We have special dermatologists.
Yes, skin specialists.
Yeah, skin specialists. So they can be able to really explore and advise you and give you the appropriate treatment. Because some of these treatments are controlled. You may find like we have steroids in them, and in most cases, if you use the steroids not very well, they may lead to other complications. So we really need to ensure that parents seek the right attention from the professionals.
Even the adults as well with this condition, and just not to get medicines over the counter. You know how people go to pharmacies and say, give me this, give me that, give me self-diagnose.
No, actually that one we restrict it. Yeah, even according to our regulators, you should go with the prescription. So in most cases, we advise parents seek advice from the professionals, and they will be able to get you the right treatment to manage your condition.
Wow. Thank you, doctor. Thank you for that insight this morning, and thank you for coming into our studios this morning. Well, that was all from me here on Wellness, and I have been talking to Dr. Moses Muliowa of St. Ruth's Medical Center, and we have been talking about atopic eczema. Now you know what to do. Please don't get those over-the-counter ointments. Make sure you see a dermatologist and get the right thing that works for you or your baby. Well, that was all we had on Wellness this morning, but don't blink because we have quite a show lined up for you. See you in a bit.